Hello, auricular friends. I'm here to answer some last questions from our auricular points 4 class and lab. So let's get started. One question we got from early on was, how do these points work on their own? The answer is they work great on their own. For those of you who were there for the first class and experienced the NADA protocol, we do not need to do ear points in conjunction with body points, although they do also work great in conjunction with body points, and we'll talk a little bit more about that. What is the treatment principle in needling points? Is it more for excess or for deficiency? So neither. Ear acupuncture points are adaptogenic or regulatory to some extent. So for instance, if you needle the knee point, you can needle it for either an excess or a deficiency condition. You do have to inform that with a treatment principle, right? So if somebody has knee pain from kidney deficiency, you want to also needle the kidney point. If they have knee pain from an injury that's created chi and blood stagnation, you're going to want to move the chi and blood stagnation. And there are some points that are particularly more helpful for different kinds of functions. For instance, Urjan, we generally use Urjan when we have an excess condition, but that's not true for most of the points in the ear. Next question, is it considered bad to be an oscillator, or are there instances where you'd want to promote more oscillation, opposite handedness, other side brain activity? Yeah, there's no good or bad to being an oscillator. Like being left-handed, it puts you in a minority position. And so sometimes you may be more challenged, right? Because some kinds of desks and things like that are not set up for left-handed people. And some kinds of medications and things like that are not set up for oscillators. So if you're an oscillator, or if you have patients who are oscillators, you want to pay attention to that, right? So you may need to do different things to make that patient comfortable, or be open to the fact that a treatment that may work for somebody else might have to be adjusted for an oscillator. But are there advantages to being an oscillator? Sure, just like there's advantages to being left-handed. Many great athletes are oscillators, and you'll see they're ambidextrous. They can dribble with either hand. That gives them an advantage. Many artists are oscillators. Many healers are oscillators. So people who have had different kinds of autoimmune conditions and difficult conditions and who discover acupuncture sometimes decide to become acupuncturists. And those people have the advantage of being able to have an understanding and a compassion for others who may not have what is the majority presentation of a particular condition or situation. So that's a little bit about oscillating. The right and the left brain are talking to each other a little bit more in an oscillator, right? And they may be switching with the laterality disorders. So the downside is you may have dyslexia. The upside is you may be able to think of solutions that require more left and right brain communication. Next question is the cingulate gyrus point used to treat emotional pain with Ren points on the abdomen, where a lot of emotional pain can be stored? Sure, you can use ear acupuncture points in general with any body points, and they can increase the resonance of your treatment because it's coming from two different places. So absolutely, if you can reach the Ren channel, you may want to use cingulate gyrus point with that, or the cingulate gyrus point may be able to be used with any number of body points that will help to inform and increase the intensity and the value and the working of that point. Next question, I watched the YouTube and I was wondering what the ear probe looking machine used to diagnose the patient was. It made a noise when the point touched where the patient had pain. So then the patient had low back pain around the C5 point. So the electrical point finder is sometimes combined with a sort of TENS machine. So not only can it find areas of electrical activity, but it also can apply electrical activity. So like it's almost like a little electrostim. It's a fun tool, but it works just as well to rely for diagnosis on markings and using a probe to feel for tenderness. Sometimes the point finder can give false positives. For instance, anywhere around the heart, everybody's going to have that point finder makes a noise for around everybody's heart because there's a lot of electrical activity around the heart. And so the point finder, it can be a little bit of a distraction Sometimes there'll be some electrical activity that's not necessarily indicative of a problem, and it can lead you down the wrong path, but they are fun, absolutely. One question is whether or not you do this type of ear bleeding from the video in your own practice. Yes, I do ear bleeding. I don't always do the whole ritual of 9 points like Li Chen Huang, but especially to reduce heat in the case of a fever, to bring a fever down quickly, it's great. Or for lowering blood pressure. What would be a situation when bleeding is necessary? Right, so just what we just talked about, reducing fever, reducing blood pressure, any kind of intense inflammation. How much blood should you let? As much as you can get, as long as the patient isn't showing signs of blood deficiency. How do you determine when to treat the body issue more through the ear versus using points on the patient's whole body? Is it due to severity of symptoms or the setting being accessible? Well, you don't have to choose between ear points and body points. You can combine them very effectively. An example was from this morning. I got up, I had some swelling in my ankles. I had a lot of things to get to today and I wanted a fast result. I did not want to sit for a half an hour with needles in. I wanted to get up and about. So I just literally with a fingernail worked on the ankle and the feet points and watched that swelling go down. So oftentimes I'll treat an ear point first to get things moving and then follow with body points. So in that case, you're using it for speed. If a patient comes in very anxious, etc., sometimes I'll just put in Shen Men before I put in the other points so the patient starts to relax and they're more receptive to the other points in the body. Convenience and speed are two of the best reasons to use the ears. Accessibility, right? So a patient comes in with a problem on their tongue. How do you treat the tongue? Well, you may treat the root cause or you may treat the channels that go to the tongue, but why not use the tongue point directly? The inner ear, how do you treat the inner ear? Again, there are points that go there, but you can treat the inner ear point directly. The uterus, sure, you can use spleen 6 to go to the uterus, but why not take the direct route and use the uterus point? Or use it in conjunction with the spleen point, right? The spleen 6 point, and that gives the spleen 6 point like a little message, right? About which of its functions you're interested in having it do. In terms of body points on the ear, like let's say the large intestine 4 point on the ear, we use those mainly in terms of helping us determine which point choices we're going to make in the ear. So for instance, if somebody comes in with a headache, there's many pain points we could choose from, but we know that large intestine 4 is particularly good for headaches because not only does it treat pain, but it also, the channel goes to the head. So in that case, we might choose the thalamus point for pain because the thalamus point sits right where the large intestine 4 would be. As opposed to choosing, I don't know, like the sympathetic point for pain in that case. Doesn't mean you couldn't choose both, but that's how we use the body points on the ear. Just curious, would we have practiced electrostim during our lab? Also, do you use it often out in the field when treating patients? I have not found much use for electrostim. In most cases, I find that it doesn't really add much to the treatment, and this is exactly what we found with doing NADA in the early days. Originally, we were doing the lung point with electrostim, and then when everybody ran out of money for batteries, we found out that the NADA protocol worked just as well without the electrostim. The exception I found is when you're treating nerve-related problems, so something that is electrical. So Bell's palsy, I have found that the electrostim does make a difference, and I do use electrostim on the face points or whatever points we're using with Bell's palsy. It's inconvenient to do electrostim because you're using 1/2-inch needles, right? If you use 1-inch needles in the ear, they tend to come out just because they're large in comparison to the small body part you have them in. And if you're using 1/2-inch needles, they come out easily as well because they're short. So you have to tape the needles down to keep them from coming out, and you have to tape the leads down as well. We don't usually do that in the lab, but we could if somebody wanted to. Is there a contraindication for electrostim? Same as electrostim on the rest of the body, pacemaker is a contraindication and or caution. In electrostim, it seems frequencies increase as it moves further away from the center of the ear. Is that because the further regions are less sensitive and able to tolerate stronger stimulation? Frequency zones were established by Nogier. Frequency is assigned wherever the regions resonate with that frequency. So the way they tested it was with frequency of light. They would check conditions and check the frequency of light. And when the conditions were affected by a certain frequency of light, then they knew that was the frequency, and they tested over and over and over again. Frequencies are also affected by what you're treating. So you're going to use a lower frequency for visceral and somatic disorders and a higher frequency for neurological disorders. And as you can see when you look at the ear map, many of the somatic and visceral disorders are toward the center of the ear in the conchas, and then the neurological functions a little bit further out. So that can make a difference as well. As in the PowerPoint, you see that you use a 5 for visceral, 10 for musculoskeletal, 40 for neuralgias, and all the way up to 160 hertz for the cerebral dysfunction. So just since there's a lot of interest in electrostim, to go over it, the first thing you want to do is make sure you're using needles that have metal handles, not plastic handles, because metal is going to conduct the electricity. You're going to tape the needle down with medical tape, because otherwise the vibration is going to pull that needle out. You may also have to tape the wires so they're secure, because otherwise the wires, as they vibrate, can pull out the needle, and that's true even for the microchips. You attach 2 points on the same ear to the clips, or it can be 1 point on the ear and 1 point on the same side of the body as the ear. You're going to preset the electrical frequency either to a slow 2 or 10 hertz frequency, or to a dense disperse, which alternates 2 and 100. And you're going to gradually raise it to the perceptible subpain threshold. And again, lower frequency for visceral and somatic disorders, higher for neurological function. Now we have a question about ear seeds. Some practitioners instruct patients to rub or press on it throughout the day, while others instruct them not to touch it to prevent irritation or injury. What is the ideal way of maintaining ear seeds? I usually tell patients to hit it about once an hour for 2 minutes. When I say for 2 minutes, I'm talking about just keeping it pressed lightly for 2 minutes, okay? So we're not talking about jamming that point when you're pressing on it. Like, basically what you don't want to do is break the skin or irritate the skin. So some people just really go after it because their symptom is bothering them. So just in general, like once an hour, just give it a nice firm press for a couple minutes. And obviously, if the point starts to become irritated, then you don't want to do it as much. Okay, week 5. What do shiny areas on the ear mean? In Chinese medicine, shiny can mean like even more so. So if an area is red plus shiny, then it's generally inflamed. It's hot and inflamed. So it's not just heat, it's superheat. If a white area is shiny, consider it even more white. So shininess in Western medicine often comes from a scar, right? So that it's a kind of coldness. The whiteness is like a kind of coldness where things can't get in. It's a blockage. Generally not a heat blockage. And so there you're going to get a shiny white. If it's a shiny red, then you have heat there. Sometimes it can be a cancerous growth if you see something shiny. So think of like a shiny cancerous mole. It can also result from organ removal, according to some sources. So organ removal would be the equivalence of an internal scar, right? So you can get a shiny spot where there was an organ removal. Diagnosis, are moles significant in any way? What about piercings? Do they affect the corresponding part of the body? So freckles don't usually have any significance. Moles from birth don't generally either. If you develop a mole, that mole usually is developed in relation to something that's going on in your ear, in your life, in your body, in your ear, everywhere. And so that can mean something. So we know that during pregnancy, some people develop through the hormonal bursts. So this mole here on my lip and one down here, I got 24 years ago during a pregnancy, and then those are for life, right? So those are little pockets of hormones. So that could reflect in the ear. So that's most piercings. Piercings don't make any difference. Like we said, the ear is like a keyboard to a computer. So the ear allows you to see things and it allows you to affect things positively. But like if you take the keyboard away, it doesn't affect the computer, right? You can just put another keyboard on or not have a keyboard. So a piercing, the only thing that happens with a piercing is that the point's not there. So generally the point will move over a little bit. So if you have a piercing at the eye point, which many people do, right? The traditional eye point piercing in the middle of the lobe, then your eye point is a little bit away from where that hole is. How would you treat tinnitus due to chronic liver yin deficiency? Local point, you'd use the inner and or the outer ear. Liver point for liver yin. The kidney, because the kidney not only is related to, opens to the ear, but also is the mother of wood, and where you've established that this is a wood-related problem. Probably sanjiao, because the sanjiao surrounds the ear and also unblocks obstruction. So that would be a kind of point prescription you could use for liver yin deficiency. What is the time of day connection to the grooves on the earlobe? Oh, I know what it is. So in the PowerPoint, if I set a point, it was at 4 o'clock. Let me show you on the, let's see if we can find. So it's just like 6 o'clock is straight up. 12 o'clock is straight up, 6 o'clock is on the bottom, 3 o'clock is to the side. And you can imagine, 4 o'clock and 5 o'clock. So I was just describing the angle of the groove on the ear. In terms of ear diagnosis, thank you for doing your diagnoses of your various ear pictures. Some of them were really fun and interesting to look at. The person who saw a bump in the uterus point for somebody who was pregnant. We had quite a few people who had markings in the liver and cirrhosis area for people who had alcohol, drinking or drug problems. One thing I do want to say about the quiz, I had a number of people worried that they thought they didn't get enough right on the quiz. Just remember, that's the very first time you've been doing diagnosis in the ear, just the very beginnings. And in many cases, it gives you a clue. It's like somebody giving you a clue when they answer your diagnosis questions. If they say they have constipation, so you may go after determining, is the constipation caused by heat? Is it caused by stagnation? Is it caused by blood deficiency? It's all kinds of reasons. So you're not always going to get it right on the first guess. It just gives you an area in which you want to ask further questions, okay? So nobody's getting graded on that diagnosis quiz. Everybody gets 100% if you answered questions, regardless of how you answered them. So I just wanted to say that. Wasn't at all meant to diminish your confidence. You guys are doing great in this class, especially considering we're not being able to do it in person. So ear maps, let's talk about ear maps. I have not given you any ear maps. I'm sure you found some on the internet. I'll put a few ear maps into Moodle for you. I purposely didn't do that until after you learn all the points. And the reason why is that every ear map is different. They all show points at in different locations. And so that can be really confusing when you're just first studying. And not only is there the Chinese location and the European location for the same point, but also just over time, people develop different ways of looking at the points, just the same as the Japanese location of points is different from the Chinese location of points. So that's the reason I didn't give them to you so far, but I will put some on Moodle so you can use them. People ask, do I have a favorite one? I like the Auricular maps, but use whichever ones you like. A lot of people like the map, the ear map from the Shanghai text, which is one of the texts that you have required for this class. One thing I do want to say, and this is about testing. So a couple of people asked me, they said, oh, I found a certain point located here in this book and here in that book, and which is the correct location. In real life, you'll try both. You'll find locations that you like. Those are the ones you'll use, or you'll try 2 locations. Or what I do is, my preferred locations, I'll check them first. If they don't work, then I might check some alternate locations. For testing, so for the comprehensive exams, if you get asked a location, you want to use the Shanghai and the CAM locations because those are the required texts for this class. When you're taking a national exam, you want to look at which books they're using and you want to use the locations from those books. Those may not be the locations that you're going to use in real life, but you want to go by whatever locations are in the required texts for that class or for that exam. So I think that makes sense. Let's talk a little bit about a couple of points though that people have questions about. I want to share screen and talk a little bit about Shen Men and about Thalamus, because those are 2 points people had questions about. Okay, so first we're going to talk about Shen Men, and now you'll see why I don't usually use a whiteboard, because I'm a terrible artist. But this thing I just drew for you, let's pretend that this is a triangular fossa. Okay, so the correct location of Shen Men in most cases is right here. Okay, so that is, if you consider this the head of a fish, right? This is the eye of the fish. Okay, and it's 2/3 over. So if you divided this into thirds, right? Okay, so maybe he should be a little bit over. Let's move him. Okay. Anyway, that's the eye of the fish, okay? And then you're going to also divide it into thirds going the other way, right? So he's in the top. Oh, I'm not a very good drawer yet. But this guy is, so 1/3. And you can imagine the other third is here. Okay. So the eye of the fish, see right where this corner is? That's where I should have drawn the eye of the fish, around there. Okay. Oftentimes you will see people put Shen Men right. Let's see here. They put Shen Men right here, right? And that's correct. Shen Men's a really big point. So it's this whole area is Shen Men. But if you put it right where the star is, you're right on top of the pelvic cavity. So that's one of the reasons I prefer to move Shen Men to this side of the point, because that way you're not on top of the pelvic cavity in case somebody has an unstable pregnancy. You also want to avoid going all the way over to here, where you're going to hit the uterus point, or in the middle here, where you're going to hit the antihistamine point. So that's why I do Shen Men there. So we're going to get rid of that. And the other point we want to talk about is the thalamus point. So I'm going to share my screen again and show you that here you have what you normally see in diagrams, right? So this is the antitragus, and it's like a little hill, and there's a behind part and an in front part, right? But in this picture and in this picture, you can see that the antitragus sort of bends forward, right? So the top of the mountain here is facing us instead of upright as it is here. So you can see the mountain bend over, and so the top of the mountain here is facing us instead of facing north as it is in this picture. So in this picture, you'd have the asthma point in front, and in back of this, in back of the antitragus that you can see, would be your thalamus point, right? But on this guy, where the antitragus is created a perch, right? People often remember this because they think that the asthma point, which is also called the parotid point, parotid is like a parrot, and the parrot sits on the perch, okay? So here you'd have the asthma point underneath the perch, right? Because it's bent over, and you'd have the thalamus here. So the thalamus then becomes more visible. It's the underside, but the underside is now more accessible than what's the front. So that's a little bit about the location of the thalamus, and that's exactly why for the points on the antitragus, you'll often see in different sources, they'll say it's on the front or it's on the back or it's on the underside, and it's really somewhat confusing. And that's why, because what they're calling the front and what they're calling the back depends on whether the person's antitragus is bent over like that. In real life, the antitragus is not so thick. If you needle the front and you get into the needle in deeply enough for it to stick, you know that you're needling the back as well, because you're in the same point in the middle of the ear. So hopefully that helps with Shen Men and with thalamus. I think that answers all of your questions. I was asked about an alphabetical version of the handbook, and I think that's a great idea. and I will be happy to do that for you. One of the students volunteered to do it, and I prefer to do it myself, so it will take a little while, but I promise you I'll get you that when it's ready. I do hope that some of you participate in lab when you get back to school so we can actually practice doing the points. If for some reason you're unable to, a couple things I really encourage you to do is learn how to do the endocrine point, learn how to do the vagus point on the back of the ear, and practice needling every different part of the ear, because you have to hold the ear a little differently for each part of the ear. But I hope we get to do that in person together. I encourage you to participate in outreach. Usually we do not a protocol at outreach, but it's really fun and you get really good at your not a protocol locations and the protocol itself. Remember, the not a protocol includes more than the locations. Please feel welcome and encouraged to keep me posted on all your auricular activities through the rest of school and through life. I love getting pictures. Send photos of ears that interest you, or cases that you work on and succeed with or have questions about. Grades for this class have already been put into Moodle, so you can see what your grades are in the class. You all did very well. And you're no longer auricular braves, you're auricular warriors now. I'm sorry, I want to cry, because you can make a real difference in people's lives with auricular acupuncture. I know you're already, just by being who you are, making difference in lives and making a difference in the world. So this is another tool that you can use to keep making a difference in the world. And I hope you enjoy this tool. I hope you use it, and good health to you all. It's been a pleasure to have you in this class, and I look forward to seeing you when you get back to school. Take care.